Hi, this is the fourth medical talk. It will be about the eye. The first concept we have to learn is about accommodation. Accommodation can be seen on the picture on the right. It is to transform light from a big source into a small dot. So it needs to go through a lens. On the left, you can see light bends as it goes through a glass. So because the velocity changes, so the light bends. The whole eye acts as an optical lens. So picture on the left, the lens itself provides 1/3 of the refractive power. The rest is provided by the remaining parts of the eye. Even the fluid in the eye is working to bend the light. So for example, the cornea has a 1.38 refractive index. The aqueous humor is 1.33, which is the fluid in the front of the eye. The vitreous humor, the liquid, is 1.34. So the lens is only 1.4. So if one part is out, or if one part is not correct, it will cause long or short-sightedness. Children can adjust their lens to change their refractive power. It is flexible and ligaments can pull. But old people the lens become less elastic because of protein build-up. By the time of 45 to 50 years old, it can only change by 15%. By the time of 70, the lens cannot change anymore. So the vision becomes fixed at one distance. That is why old people often need bifocal glasses so they can see far and near. Right, the top part is far, the bottom is near. Okay, you can see the lens is here. So the second concept is pupillary diameter. The pupil increases the amount of light that enters the eye during darkness and decreases during daylight. The pupil is the black dot here. It can go as small as 1.5 mm in diameter and increase up to 8 mm in diameter, which allows an increase of light up to 30 times. In this diagram, you can see there are a lot of blood vessels in the eye. The red are the veins, the blue are the arteries. The red are the arteries, the blue are the veins. So there are three main problems with vision. One is hyperopia, one is myopia, one is astigmatism. There could be one or two more, but they are not very common. So I'll just cover these three. Farsightedness is hyperopia. It's because the light goes behind the eye. This is because the eyeball is too short. Often because the eyeball is too short. So short-sightedness is because the light is focused before the retina. It's in front of the retina, so because the eyeball is too long. Astigmatism is because the light is bending either up or down or left or right. So on the left picture, we can see the ligaments pulling on the lens. The right picture shows farsightedness on the top and short-sightedness on the bottom. Notice where the light touches, where the light focuses. This is astigmatism. Astigmatism requires optometrists to use two lenses to test. They will just randomly test to see which vision is better from the two lenses. So one is to correct the BD plane, which is the top bottom plane. One is to correct the AC plane, which is the left and right plane. Next concept is visual acuity. Visual acuity is to explain why humans cannot see a small object far away. We know eagles can see a rabbit 5 kilometers away. What is it that causes the limitation of our far vision? So the cones of our retina is about 1.5 micrometers apart in diameter, So for us to see two dots, we need to see the object. We need the object to fall on at least 2 micrometers so they can touch two cones. If they just touch one cone, means we will see two lights as one dot. So if you look at the picture on the top left corner, we can see a 1 mm object. If it makes a 2 micrometer distance apart, then you can touch two cones, then you can see the object as one object, right? On the bottom left hand side is how we tell the distance of an object lah. So by looking at the relative distance from a nearby object, then we can tell the distance of a far object. So on the picture on the right, we can see what is a 20/20 vision. Row number 8 is a 20/20 vision, whereas row number 1 is a 2200 vision, right? The E is 10 times bigger than the E at the bottom, correct? Yeah. So this is 20/20 vision, which not many people have, but 20/20 is still not perfect vision lah. Okay, 20/20 is just normal vision. If you want to see even smaller, you can see row 9, 10, and 11. Okay, the next concept is intraocular fluid. There are two kinds of fluid in the eyeball. One is the AH, called the aqueous humor, which is in front of the lens, and the other is the vitreous humor, which is behind the lens. Aqueous humor is a free-flowing liquid like water, whereas vitreous humor is like jelly or gelatinous. AH is continuously being formed and absorbed. So we can measure the pressure using a tonometer. This pressure is very important because if the pressure is too high, it can cause glaucoma. So what can cause the increase in pressure is if the drainage is blocked. The drainage can be blocked by a few reasons. One is because if there's an infection in the eye, if there's a bleeding or infection, the white blood cells will eat the bacteria. But when the cells die, they will block the drainage from the dead cells. So the fluid can't go out, the pressure goes up, and it can cause glaucoma lah. And okay, so this is the front part is a AH, the bottom part is a VH, and this is the ciliary body. The ciliary body looks on the right. If you see the picture on the right, this is a magnified image. This is the one that produces the AH, produces the formation of aqueous humor. So what is glaucoma? Glaucoma means the cones or the cells at the retina is dead. So it is blindness or partial blindness or full blindness. So yeah, so we can see that just a bit of increase in pressure, it can cause blindness in a few months or a few years. Whereas if the pressure is very high, it will be painful, and then within a few hours or a few days, it can cause blindness. So why does high pressure cause blindness? It's because when there's a high pressure, it pushes against the cells in the retina, so they cannot absorb nutrients. When there is no nutrients to the cells, they die. And the high pressure also blocks arteries from providing the required nutrients. So what can the doctor do? First is to give eye drops which contain a drug to reduce the pressure. If it doesn't work, then they will have to resort to surgery. This is on the left is how a tonometer looks like. They will hit it like a hammer, hit on the eyeball, and then they will see what is the pressure on the eyeball. On the picture on the left, we can see the drainage. The canal or cecum is a drainage pipe. It connects to the aqueous veins. The veins is the one that bring out the old water. If the old water cannot come out, then the new water will keep growing and growing, and then the pressure will be very high. In conclusion, what did we learn? Okay, we learned accommodation, which is how light bends and how light focuses, and how the whole eyeball acts as a lens. We learned pupillary diameter, which is how the pupils allow more or less light to come in. We learned the different conditions, far, nearsighted, and astigmatism, and what are the causes. We learned visual acuity, why we cannot see small objects far away. And we learned AH and VH, how they can cause changes in the eye pressure. And we learned glaucoma, how changes in eye pressure can damage the nerve cells. So the last point is what can we have to appreciate our eyes, because it is a miracle. Okay, take care of them, and if there's any pressure there will be pain, so get it solved quickly. And last but not least, control the blood sugar level, because diabetes affects all blood vessels including those in the eye. Okay, thank you.